Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each week, we deliver informative health and wellness topics you want to know about, so be sure to subscribe to us on your favorite podcast channel. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session, streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPAcares. Now here's your host, Chief Operating Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm your host, Kyle Longton, and with me is my partner,
Maddie Norton.
Maddie, Happy New Year.
Happy New Year, Kyle.
We had a good discussion just a few minutes ago off recording about our holiday experiences, some ups and downs there. I rang in the new year in London. I wasn't there. I just watched it on TV because that's about as late as I can stay up. Is 7 p.m.
Absolutely.
Watch that. Yep, watch the fireworks and then in bed by around 9. Did you make it to midnight for
I did make it to midnight. I got to see Andy and is it the other Andy on CNN? Anderson, yeah, Anderson Cooper. Sorry.
Good.
I was like,
okay.
I know the names there. I got to see them on TV. They were having a grand time. So I made it to midnight, thankfully.
Okay. That's good. Yeah, we did not make it quite that late in my house, but we celebrated the next morning and
Exactly.
and rung in the new year that way. So it is the new year. We've got some changes happening at AFSPA. We've also got some new benefits that kicked in on January 1st, and we have a lot of new members joining us on either January 1st or for those who are active employees, January 14th, when those changes go into place. So a lot of new members. We're really glad to have them. We are building out our team and our efforts, including this podcast, to let members know about changes. So we hope to see some more subscribers and some more recommendations for podcasts. And Maddie, in fact, you got some information from people about podcasts and topics they'd like to see covered as part of AFSPA Talks and AFSPA Live. And so we're looking forward to that. And this month we're sort of just focused on changes that are coming into place, and we've got AFSPA Live scheduled for
I want to say it's the 25th.
I was going to say the last Thursday of this month, and
it is
that
the 25th.
would be the 25th, 11 a.m. on YouTube and Facebook.
Yes, catch us there.
Yep, catch us there. It'll be the two of us again. We'll be talking about changes, answering your questions about benefits. One thing we did want to mention, we've got some other themes for the month. Maddie, I don't know if you want to touch on any other things that are happening in January, even going ahead.
First off, we just want to say, Kyle is officially the new CEO of AFSPA. So congratulations, Kyle.
I really wasn't setting you up for that, but thank you.
But I wanted to mention it because that is a change that's occurring. So if you weren't already aware, now you know. And another mention that we wanted to bring up was January is Cervical Cancer Awareness Month. So, if you are scared, a lot of times they check that with pap smears, and it's usually around the age of 21 that you should start getting them. And it can be scary. It sounds scary, but it's really a effortless process, and it protects you in the future because they are looking for those, my doctor described it to me as like pre-cancerous cells to make sure that you are not going to get cervical cancer. And we also offer lots of benefits for that. So Kyle, if you'd like to discuss those.
Mention, as Maddie said, that the screening for cervical cancer is usually done as part of an annual exam, whether you were part of your annual physical or part of what has traditionally been called a well-woman exam with an OBGYN. That is covered at 100% as a preventive service on once per year. I'll also mention that we know much more about cervical cancer than we did, even just a decade or two ago. And we know that oftentimes cervical cancer comes about from HPV, human papillomavirus, and there is a 2 or 3 part vaccine available for HPV, and they can start administering that at age 11. I think at age 11 you get 2 doses. If you start at age 12 or later, it's 3 doses. That
Yes.
is covered at 100%. And so I encourage you to talk to your doctor or to your child's pediatrician about including that if it's right for them. And we are talking about cervical cancer, so we're traditionally thinking about people with cervixes, traditionally girls and women, but they're
Mhm.
not the only ones who necessarily should be getting the HPV vaccine. It is available for all people, boys, men as well, and non-binary people. So I encourage everyone, consider this, talk to your doctor about it. This is a good month to do so. And as
Absolutely.
we're thinking about a new year, new starts, making sure that we know where we are in our healthcare journey. Um, and that journey can take a lot of twists and turns, and it can require a lot of support. And we are glad to be here to support you throughout the year. Um, and one of the ways we're supporting you is with a new program called Maven. And that's our focus today. Maddie, I wonder if you can give a quick intro about just a quick overview of what Maven is. I know we'll get a deeper dive on that from our guests today.
Yeah, Maven was created essentially to just build a more equitable healthcare system and a better world for all, and especially is great for women or families of all ages. They help you from infancy or pregnancy actually, and getting pregnant all the way to menopause. And we're very excited to hear about that from our guests today. And today we do have two lovely employees from Maven. First, we have Teresa Wilkinson, and she is a director of client success at Maven. She has over 10 years of experience in healthcare, working with health systems and employers to provide support for women and families through pregnancy and postpartum. She is also a mom of 2 young girls and a Maven user herself, and as such feels especially connected to the mission to improve access to care for all during the family forming stages.
And along with Teresa, we have Marcy Cunho, who is a director and team lead at Maven. And her work um, and her team overall works with employers that join Maven through payer partnerships. And this includes AFSPA and the Foreign Service Benefit Plan. She's been at Maven for 4 years and is a self-proclaimed Maven super user with a 2.5-year-old and a 1-year-old baby at home. And I just want to note before we get into the interview, these podcasts are focused on Maven, and bringing Maven to our members is part of our theme for 2024, which is to choose health because you matter. So please don't forget that. Please don't forget that you matter, that your health matters, and we have a lot of support for you. And without any further ado, we've got Teresa and Marcy to talk us through how Maven can offer that support. And Marcy and Teresa, welcome to AFSPA Talks. Thank you so much for joining us.
Thanks for having
Thanks
us.
for having us.
All right, so I want to start at a basic level. We heard a little bit about this in the intro and in going over your bios just a moment ago, but what is Maven? Can you tell us a little bit about the history of Maven, when and why it was founded?
Yeah, sure. I'm happy to take that one. This is Marcy. So Maven was founded in 2014 by our current CEO, Kate Ryder. And the reason that Kate founded Maven was that when she turned 30, she knew that she wanted to have children soon. And she looked to her friends and her peers who were starting to also try to have children and found that they were facing many systematic barriers, from limited provider access to rising costs, even legal and regulatory limitations depending on the path to parenthood that they were on. And she realized that even though women make up 80% of healthcare decisions, the existing care models really failed to put them and their families first. She also realized that employers, likewise, lack the solutions to support parents beyond paid leave. And so that is what really brought her to found Maven. She wanted a company that was going to deliver compassionate, accessible, innovative healthcare that really meets women and families where they are. And I've said women a number of times. I really want to highlight that the model that she built is really to support all families, regardless of what they look like, regardless of what that path to parenthood may be. Really, the model is to help people wherever they are and to guide them throughout their entire process. And so I think, the what for Maven Now, it gives FSBP members and their families 24/7 virtual care support and guidance, no matter, again, what phase of life they're in, from starting a family through pregnancy and postpartum, raising children, or going through menopause. FSBP members and their partners can meet with Maven providers, access support anytime, day or night, and really at no cost to them.
And I want to emphasize one thing that I sort of previewed for our members in some of our podcasts last year. One of the things that I was most excited about is that this is a global solution. And I don't mean global in terms of like covering you from all phases of life. It does that, as you just noted, but also around the world, right?
Yes, so important. So thank you for highlighting that. I think when we talk about 24/7, we're thinking about it in a number of different ways. One, our members are located in over 176 different countries. And so we want to be able to provide support to you no matter where you are. And our care team is really able to guide members, again, through their path to parenthood, depending on their location and depending on maybe thinking about like regulatory and state decisions and things that they might not even know about, whether they're someone that is permanently living in a location or maybe even temporarily living in a location. So they can really guide members to really understand what's the best path to parenthood for them. The other thing about the 24/7 support is that no matter what time of day it is for you, you have support through Maven. So if it's the middle of the night or if it's on a holiday, and maybe you don't have access to your pediatrician, your OBGYN, no matter what it is, you'll be able to get care on Maven. So it's really incredible to be able to have support around the clock.
I feel like we could end the podcast right here and people would still be sold on the program. But let's get into a little bit more detail. And I want to start with one of the areas in which FSBP made some big changes in 2024, and that's in the area of coverage for infertility services. And that's actually initially what brought us to look at Maven, but obviously there's so much more to it. But I want to focus first on infertility services. So the plan, just for our members to note that the plan will cover infertility services with no annual dollar limits for various forms of artificial insemination and in vitro fertilization, what we're terming advanced reproductive technology procedures that covers a wide range of things. I'll refer you to the brochure. We also offer coverage for infertility prescription drugs. And this means, hormones, injectable drugs, anything like that. Those will be covered under prescription drug benefit. So this is pulling all of this out of the $5,000 limit that we had in 2023. We were the first fee-for-service plan to implement coverage in 2023, but it did have that dollar limit. We're removing that dollar limit for 2024. Now, a lot of our staff traveled, myself included, overseas and went to events, met with members this past open season, and there were a lot of questions about infertility. So I'm wondering if one of you all can talk about why there are more discussions about this and now more solutions for infertility than there were maybe 15 or 20 years ago.
I think it's a really great question. I think that there's been, I don't want to say a stigma, but I do think that a lot of people, it was really personal. It's a really personal journey. And there was this common misconception that when people were ready to have a baby, they tried to get pregnant, they got pregnant, they went back to work, and that was it. And we know that that's not the reality. And it has come to light for a lot of people that, 1 in 6 people may struggle with infertility. And so more and more people started to talk about it. There were a lot more solutions. And I think employers who found that their employees were looking for support to help them on that path to parenthood. It can be incredibly lengthy and it can also be incredibly expensive. And so people were seeing that, people were highlighting that, and people were talking about it. And I think that that really opened the door for a lot of employers to really support employees, to guide them, and also allow them to focus on work when they needed to focus on work and, alleviate some of the struggles that they were dealing with in their personal life. And then there were solutions like Maven and other solutions that really came out to, guide employers to offer these solutions to help support them as well.
Right. And I've shared this with our audience before. This is something that my spouse and I struggled with also before we had our first children. We were going through testing and looking at our options and so forth. We didn't have the support program, anything like Maven or anything. It would have made such a huge difference for us. We were blessed with 3 children eventually, which was fantastic. But we also could have used some of the other programs that we'll talk about in just a moment. I don't want to leave infertility just yet. And staying sort of on that topic, you said 1 in 6 people around the world throughout their lifetime may struggle with infertility. Is that essentially the statistics that you all see among Maven users? And then just sort of related to that, what does family building look like for Maven users? Because it's not always a nuclear family. It's not always reproduction in the way that has traditionally been thought of, or family building in the way it's traditionally been thought of.
Yeah, so I'll start with, the kind of the fertility and family building. What is it and how we can support at Maven. And so this support is really for members who are thinking about starting a family, either through pregnancy, adoption, surrogacy, or for members who are currently trying to get pregnant, regardless of whether it's the early stages of that process or they're currently already going through fertility treatments. I think sometimes people really need support in understanding what all the different paths to parenthood are, really understanding their options, and then also having guidance to, meet with different providers and help someone really support them to make a decision with their partner on what is the path that we should go through, or without a partner, what is the path that I should really pursue. And so this program offers that guidance to members that are trying to conceive, to navigate the different fertility options like IUI, IVF, egg freezing, choosing an adoption or surrogacy agency, and even finding mental health support while trying to conceive. And we know that that is so incredibly important. And then in terms of the statistics for what it looks like for infertility when it comes to Maven users specifically, Maven's fertility and family building outcomes and impact are that 20% of members who are considering fertility treatment avoid treatment. We also have 90% of singleton pregnancy rate, and that's when it comes to IVF. A 92% single embryo transfer rate. 83% of members report being more productive at work during fertility treatment from having Maven support. And then 40% of members report finding emotional support through Maven's high-touch one-on-one mental health coaching as well.
Those are amazing statistics, particularly the single embryo transfer and the singleton birth. We don't always see those statistics across our entire population, whether engaging in fertility treatments or not. So those are incredible statistics, and particularly the mental health aspect, because that's something that at least traditionally has gone unexplored and unconsidered, I think, as people go through the medical side of fertility treatments. Okay. Yeah. So let's talk about the next step. We've got a successful pregnancy in whatever form it came about. How does Maven benefit pregnant people and those who support them, whether it's a partner or another family member, somebody in their care group?
Yeah, Maven can support those who are pregnant. Even the second they find out they're pregnant, they're able to sign up for Maven. I know that I was a Maven employee, so I did that. And so this track really supports members to learn as they, are going through that pregnancy, through that baby's first birthday, and not just the birthing partner, but that non-birthing partner as well, to follow along in that journey. And they can help with guiding them to create a birth plan, answer questions in between OBGYN appointments, or even once the baby is here. This track can offer support with breastfeeding or bottle feeding. The members can also meet with postpartum mental health specialists and career coaches as they start to think that about that transition back to work. And I think a lot of times, we talk on and on about the birthing partner. And I think that we know that that non-birthing partner, everything is really new for them as well. And so we do like to just really encourage that non-birthing partner to sign up, and they're able to follow along in that journey, or also utilize those mental health specialists, those career coaches, those lactation consultants as well.
And I so appreciate that. And I just want to take this opportunity to remind our members that FSBP offers up to $200 in wellness incentives for prenatal care. We also have coverage for doula services and an enhanced healthy pregnancy program that started in 2023. We also have coverage for breast pumps, including those models that are above and beyond the traditional models, things like the Willow, the LV, and so forth. Feel free to contact us for more information about the coverage for those. But Marcy and Teresa, I want to go back to, Marcy, something you just talked about, which is sort of the support for the birthing partner and the non-birthing partner. And that's also both those people, once they leave the birthing environment and the hospital care. So one of the things that struck me when I was the non-birthing partner in my partnership, we went to these classes at the hospital. And we had multiple classes about the birth experience. We had twins in the first pregnancy, and so specific twin classes and all of that. And then there was one single class about how to care for a child once they're born, which is a much larger part of the experience of being a parent than that one day of birth. So they then grow up, and so can you all help with that beyond that one class offered at the local hospital? What resources are available there?
Great question. So we have a ton of support for that. And that's, again, you have unlimited access to these providers. So whether it's, Teresa gives a great example of bringing your baby home, meeting with a doula because you need to give your baby a bath for the first time. Babies are slippery. Probably not something you've ever experienced. It's overwhelming. You're making sure that you're, one, supporting their head, but also cleaning them, and your partner's probably crowding everyone over the tub. A doula can help you. They can talk to you about tips and how to give that bath. You can even do it live with them on the phone. We also have a number of webinars that happen live on demand. Exactly, the content is helping to support parents to bring that newborn home. I think one of the titles is how to support parents when they bring their newborn home, or how to care for your newborn 101. So there's a lot of different classes that really go into some of the common topics. I think something else that's really important to highlight is postpartum care as well for the birthing partner. A lot of that, even no matter how prepared you are, a lot of it is going to be new, overwhelming, and you might have some questions that you came up that you weren't really anticipating. And so getting support from a doula or OBGYN for that is also can be incredibly helpful. And whether you're preparing that by taking a class ahead of time, meeting with someone to kind of help you prepare for that, know what to expect, or even have it live, when it's happening, calls with those providers. Infant CPR is another really great class that we have on demand. There's a ton of them. We're constantly adding, more of these classes because they're so impactful. But I think, a lot of people love that class in particular because it's just a peace of mind, knowing how to handle certain situations with your newborn at home can be just really beneficial for parents.
The only thing I might add, I have a 4-year-old. And so I feel like from my perspective, I'm sort of like, where are the classes on how to get a 4-year-old to eat their vegetables? And it's funny because Maven actually does support you in these things as your kids get older. The needs change. A lot of the things that your kids need support with are a lot more like behavioral, and they're age appropriate, but they're still really difficult and they're always evolving. So things like tantrums and potty training and picky eating and screen time. These are all things that Maven providers can support within our parenting and pediatrics program that's available for parents who have children that are over 1. And it's, again, very judgment-free advice, 24/7 support. Members have access to specialists, including pediatricians, parenting coaches, which I've worked with. Everyone thinks infant sleep is the hardest, but actually toddler sleep is really, really hard too. Speech pathologists, nutritionists, and it's all really there to help support you in raising, happy and healthy kids.
I have my own tornado at home. And so I know exactly what you're talking about. I think on all those fronts, and I appreciate that the sleep coach isn't just for, right after birth, because that is a struggle, and it's for the children and for the parents. But when you start to transition out of that nap time, going from 2 naps a day and then getting rid of the naps completely, I miss the naps.
Me
I think my
too.
kids do too.
Me
Yes.
too. The transition out of the crib is a really big one. I think
Yeah.
it's really nice. I mean, I think we talk a lot about examples of, like, for example, in the prenatal or immediately postpartum stage, like pelvic floor physical therapists are a great resource for birthing parents. But this is actually something that continues to be really relevant in the parenting and pediatric stage. Once your kids are over 1, it's relevant in the menopause stage. So our providers really are available to support in the full sort of lifetime. As women and families are having these questions that come up.
Well, and I think that's a great transition to another topic that's been um, of great interest and a great need among our population, and that is care for people in the stage of life where they're experiencing menopause. And as noted before, Maven is great because it is care throughout life, including during menopause. Can you all talk a little bit more about what that support looks like for people at that stage of life?
Yeah, one of the things that we talk a lot about is how studies suggest that actually 11% of people experiencing menopause miss work due to their symptoms, which contributes to global productivity losses of about $150 billion a year. So it's a lot. It's really, really impactful. And actually, 1 in 10 women quit their job altogether because of menopause symptoms. So beginning to really normalize and appreciate how your members are affected by menopause, I think can start to limit the impact it has on their overall well-being and productivity. So it's so exciting that this program will be available to FSBP members. In terms of what the menopause program looks like, the Maven Menopause and Ongoing Care Program, it supports all impacted individuals through really every phase of the menopause journey. So you don't need a menopause diagnosis. This includes early menopause, perimenopause, menopause, HRT, and postmenopause. So really the whole gamut. And Maven's going to provide really high touch navigation to in-person specialists, and then also virtual access to that same list of Maven specialists who can provide guidance on symptoms and treatment plans. We also incorporate dedicated mental health support into this program, as well as career coaching, because as we mentioned, this can be really impactful to company leaders. And again, making sure that we're really pushing that clinically sound education throughout the whole journey.
And again, available around the world, right?
Around the world. Yep.
Fantastic.
24/7, 365. That's the TLDR.
And no, but I think it's so important for our population because we've heard from members at the State Department in particular around the world. They did a global survey, and support for menopause in that stage of life was something that really came through as a real need. And so I'm so glad. I mean, we again just wanted to emphasize for our listeners, we found Maven because we were looking for support for fertility, and we found a truly comprehensive solution that offers global support. So encourage you, if you're interested, we'll include a link in the show notes and information in just a few minutes about how to access that. But before we get to that, Marcy and Teresa, thank you both so much. I know we've only really scratched the surface and are offering an introduction really for our members about Maven and all that it offers. Is there anything you feel like we missed for this introductory conversation? Anything you want to add?
Did we talk about our care advocates, Marcy? I wonder.
Let's do that. Yes.
Yeah, I want our care advocates. We talk a lot about the providers that are available to our members sort of 24/7. But our care advocates are also a really wonderful resource in Maven. they become really the member's sort of go-to and provide really high-touch navigation, both within the Maven experience and also more broadly. So they're going to get to know the member, really understand why they signed up for Maven, and then start to connect that member to appropriate, certainly Maven resources, specialists, and content. But they're also available to create personalized referral lists to those trusted in-network or in-person providers that meet their specific needs. So for FSBP, for example, our care advocates sort of understand the benefits ecosystem really holistically. And if a member is looking for something where Maven is maybe part of the solution, they're also able to help make sure that the member is sort of cared for in person as well.
And I think, just in learning about Maven previously, you all work to help connect people with a care advocate who understands them and meets their needs. So if they're on the fertility journey, if they're in the pregnancy journey, if they're in the menopause stage of life, et cetera, connect them with someone, and also someone who is understands the culture from which the member comes and can meet their needs. Is that right?
Absolutely. Yeah. Our goal is to provide really culturally competent care across the whole Maven experience. So our providers, our care advocates, and also our content.
Excellent. Thank you. That's a key piece, to have that really a partner throughout the journey, and throughout the Maven experience is key, and I think will be a fantastic support mechanism for our members. Marcy, anything that you feel like we should touch on before we wrap up?
No, I think just overall, we're so excited to partner, and I'm really, really excited to see, employees start to utilize the program and, how we are able to support them as well. So really looking forward to seeing some of those early insights from the engagement.
Excellent. We are too, and I hope our members will start taking advantage of this right away. Marcy, Teresa, thank you both for joining us today.
Thanks for having us.
Thanks for having us.
Thanks again to Marcy and Teresa for joining us today. To learn more about Maven and to sign up, go to mavenclinic.com/join/FSBP or look for the link in the show notes. See the 2024 FSBP brochure for full details on infertility coverage and other coverage. Please note that all infertility services, whether received in the U.S. or overseas, require prior approval. Call 1-800-593-2354 prior to scheduling services. You can also connect with a fertility advocate by calling 1-833-415-1709. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. All information offered in this podcast is meant to be educational. The views expressed by the host and guests are their own and do not necessarily represent AFSPA. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or the other products offered by AFSPA, the policy provisions will prevail. Thanks for joining us, and we'll talk again soon.
Thanks for joining us this week on AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live on our YouTube channel at youtube.com/AFSPAcares at 11 a.m. Eastern Time to answer your questions. Thanks for listening.